This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, can everybody hear me?
Loud and clear.
All right, perfect. Okay, so hey everybody, I'm Brian Wacker. I'm one of the PGY3s here at University of Missouri. I am joined with fellow PGY3s, Dr. Connor Schwartz and Dr. Blake Dreyer. I think our program director, Dr. Claire Finkel is here as well. They see to make sure the three stooges of the program don't do anything too crazy here. So we'll go ahead and get started with our presentation. So here is our leadership. Again, like I was saying, we have Dr. Claire Finkel here. She's our residency program director. She took over, I believe, about 2 years ago. And then we also have our associate residency program director, Dr. Brian Todebush. Both are alumni of the program. Here's a brief view of our faculty as well. I'll highlight this again. So a lot of our faculty did their residency at University of Missouri, so they liked it enough to stay. We have Dr. Joseph Burris. He is the former program director and is our current department chair. We also just recently welcomed back a few of our most recent graduates, Dr. Stephen Lubert, who is doing PM&R at the Veterans Hospital here in Columbia, and also Dr. Hannah Farmer, who is doing stroke rehab and consult. Here is a sneak peek of our current residency class. At the top, we have our PGY4s. Dr. Benjamin Boyette is our chief resident currently. PGY3s below them, 2s below them. And then at the bottom, we have our current interns. So we are an advanced program here at University of Missouri. So you will need to match into a separate intern year. I will say that about every year, we do have someone who does do the preliminary medicine program at University of Missouri. I believe it is still one of those situations where you still have to apply to the program, but if you interview with our PM&R program, you are automatically considered for the preliminary medicine without having to go for a separate interview. So we're kind of from all over. Me personally, I'm from Virginia. Connor Schwartz, he's from California. Blake is actually from right here in Missouri. We also have some residents a few from Texas, North Dakota, kind of all over. Medical schools, again, kind of all over as well. California, Texas, Indiana. So here are our training sites. So our primary inpatient rehabilitation rotations occur at Rusk Rehabilitation Hospital. Our consult service, pediatrics, a variety of other things occur at our main hospital, University Hospital. We have our VA, which is right across the street from University Hospital, where you'll do your pain rotations, some outpatient PM&R. And then we have our Missouri Orthopedic Institute, MOI, where you will be doing sports medicine, spine rotations, and a variety of other outpatient experiences. I will say that all these locations are within 5 minutes of each other, so very easy to get around. If you usually, as residents, will park at the Missouri Orthopedic Institute parking garage, and you can walk to University Hospital, the VA hospital, but you will need to make a quick 5-minute drive to Rusk Rehabilitation Hospital. So in terms of our rotations, once you complete your intern year or transitional year, preliminary medicine year, you will come to our program, and you will do a majority of your second year at the inpatient rehab hospital called Rusk Rehabilitation. You'll do about 10 months there, and then you would do the remaining 2 months in an outpatient setting, whether that's in our outpatient PM&R, which we title Rusk 1, or you will be doing some sort of spine pain rotation we entitle RUSC 2 or RUSC 3, which is kind of our sports medicine outpatient experience. So again, second year, you'll be doing a lot of inpatient medicine. And then once you get to your third and fourth year, it'll be more outpatient and consult experience. One thing that we do highlight frequently with our program is the amount of procedures that we get to do. We get to do a lot of hands-on procedures. I'll highlight some numbers later in the presentation, but we don't have any competition with any fellows. All the faculty in the outpatient setting are very open to having residents put their hands on needles, ultrasound almost from the start. Very good teachers. And you also have obviously exposure to kind of a large academic setting being at the University of Missouri and those variety of outpatient experiences we have at the Orthopedic Institute and VA. So here's a ample schedule if you kind of look at our year. So again, like I said before, as a 2, you'll be spending 10 months at the inpatient hospital, and then 3 and 4 will be a mix between outpatient, and then you will have to do an additional 2 months of inpatient over your last 2 years. So these are not set schedules. You do have some flexibility when you become a third year of when you'll do these rotations, such as pediatrics, consult, ENGs. So here are kind of the outpatient rotations I was discussing. So again, we have RUSC 1, RUSC 2, RUSC 3. So RUSC 1 is going to be kind of our more outpatient PM&R, which is actually located at the rehab hospital itself. You'll be doing spasticity management with Botox. You'll be doing amputee care. That's a big part of our program. We do see a lot of amputees. You'll be doing some outpatient spinal cord and some backup and pump Botox injections as well. RUSC 2 is our interventional pain and spine, and RUSC 3 is, again, our general MSK and sports medicine. You'll also be doing some ENGs at the Missouri Orthopedic Institute, which we entitle UMC EMG. You'll also be doing some of those at the University Hospital. And then our VA, which again is right across the street from University Hospital. You'll be doing pain, interventional spine procedures. You'll also be getting exposure to kind of a general outpatient PM&R feel as well. There you'll be doing some EMG and some musculoskeletal medicine as well. And then again, you'll have to do 2 months of pediatrics. We usually do those pediatric months back to back. And that is with our lovely faculty member, Dr. Emerson. So here's the numbers I was talking about. So we consistently rank above the 75th percentile in all major ACGME procedures. We do really well with interventional spine injections, especially at the VA. You get a lot of exposure there. Actually, all 3 of the PGY3s that are here tonight are currently at the VA, and we're loving it. You also do a variety of other things: ultrasound, musculoskeletal injections, phenol injections, Botox, vertical injections, you name it. So here's kind of just some general numbers of what you'll see through your years. So PGY4, you'll be getting a lot of your procedures. Actually, almost all your procedures will be happening in your third and fourth year. Again, here's kind of just a general outlook of our numbers in terms of spinal injections. And then I'm going to go ahead and hand it over to another one of our PGY, Dr. Connor Schwartz.
All right, guys, can you hear me okay? Good, yeah?
Yep.
Okay. Like Brian said, I'm Connor Schwartz. I'm one of the third year residents as well here at Mizzou. And just so you guys know, we have Blake Dreyer is in the chat as well. And if you guys have any questions, you can put them in the chat or wait till the end. It's up to you. So the first slide we'll go over, I get the fun stuff talking about finances and kind of things outside of the program. But I would say we have a good salary here, considering for the cost of living. Like Brian said, I came from Northern California, where I'm from, and did my intern year there, and can say that I got about the same salary with about twice the cost of living. So it's very affordable here for sure. Whether you have a family, and a lot of our residents rent a house, or if not, apartments are pretty cheap and they're pretty nice. And we usually get a raise depending on kind of the inflation and things like that, depending how much that is. But yeah, it's a great salary. There's also 2 airports. There's one locally here in Columbia that American flies out of, and then 2 major airports, Kansas City to the west, and then St. Louis to the east. Columbia is about halfway in between both, and it's about an hour and a half away from both those airports. All right, and then, so research, kind of at our program, there are plenty of opportunities to get involved in research that's specifically related to PM&R. We have some pictures here. Duncan Brault, one of our recent graduates, along with Hitomi Obayashi, and our former chief there, presenting at a sports medicine conference there. But we have a new kind of next gen facility is what it's called. And we have a lot of PM&R research specifically that goes on there. A lot of neuromuscular research with Dr. Arnold, who's part of our staff, and Dr. Castro. We have plenty of opportunities. We have our own Mizzou PM&R or Mizzou Research Day, along with poster presentations at AAPM&R that people have gotten accepted to, many of our residents, and AAP as well as specific, whether it's sports medicine or pain research that our residents have been involved with and done podium presentations or poster presentations. All right, kind of the extracurricular opportunities or educational opportunities. We do a musculoskeletal ultrasound course, typically on Wednesdays when you're on outpatient rotation. So that's with our 2 sports medicine attendings here, Dr. Todebush, who's in the top right corner there doing some sideline coverage, and then Dr. Washburn, who I believe was covering a boxing match or a UFC match here when I asked him. And then we also have a MedZoo clinic, which is our free kind of MSK clinic that we typically do as residents. You do it twice a year, and you can volunteer more if you would like to. We do sideline coverage. Dr. Todebush covers some high schools in the area and always has residents going out there with him. Mizzou has a wheelchair basketball team that we get to cover sideline coverage, which is always fun. There's a P&O conference for prosthetics, orthotics that we do every year. We have prosthetists in the area that come out and give us lectures. That's really informative, and also other PM&R doctors that fly in for that. That's right here at Mizzou. We cover a lot of Mizzou rec sports. Brian is kind of the one in charge of this, but we do cover water polo, sideline coverage with rugby. I know they've done Quidditch in the past, so there's a lot of opportunities. I saw in the chat on the last one, but a lot of opportunities for sports medicine coverage at our program. And then we also have a neuro PT program that joins kind of our didactics and journal clubs and gives us some lectures as well. So kind of that interdisciplinary approach to medicine as well. All right, so past fellowship matches. Just kind of showing that we have a lot of, if fellowship is kind of what you're going for, we have plenty of residents that have matched. I know last year we had one pain, ACGME pain, a NAS, sports and spine, and sports medicine, all matched to fellowships there from our last year's class. All right, and then about Columbia. So Columbia is about 100,000 people. Like I said, it's located in between Kansas City and St. Louis. It's a pretty big college town. Kind of everything revolves around the university. So there's always plenty of things to do. There's live music. There's in the fall football games, basketball games. It's an SEC school, so a lot of things to do from that front. There's a lot of restaurants. There's actually a pretty good food scene, which I was surprised coming to Missouri to see. But you can find plenty of good restaurants downtown. It's a pretty good sized downtown that runs right into the university. So, all right, here's just some pictures showing in the top left here, going over an EMG lab with one of our attendings, Dr. Jones. At the bottom left-hand corner over at the VA, working on axial spine procedures. In the bottom right corner, we have an Ipsen cadaver lab, which we just completed last weekend, but we have anatomists that come out and bring limbs, and we're able to inject the limbs into different muscles for spasticity, and then they kind of do a dissection and show us the origins and insertions of the muscles and if we got our injection. So it's a pretty good learning opportunity. And then in the top right, that's our P&O conference that we kind of talked about earlier. That is Blake Dreyer there trying on a lower extremity orthosis with one of our prosthetists that's local here. All right, some more pictures. Just that top left, that's at graduation last year. On the bottom, just some research from some of our current residents and former. And then top right, just showing that's kind of our wellness. We do sand volleyball and some other. I know a lot of people get together, play pickleball, things like that in the community. And so this is showing kind of our involvement with the medical school in the top left-hand corner. Andrew Goldblum going over ultrasound with some medical students, some more EMG in that top right corner. Bottom left corner, we have an amputee golf tournament that we put on and participate in. So that's a few of our residents playing golf there, and with some fellow amputee patients that were previously at our hospital. And then the bottom right, some more medical school teaching with the ultrasound there. All right, some more, just some pictures of our new residents up top there, our new PGY2 residents on that right side with Dr. Totebush, our sports medicine. We do a sports physical day at MOI every year, which is our orthopedic institute with family medicine, the fellows, the sports fellows there, and orthopedic surgery as well, all kind of helping out the community with high school sports physicals. Right. And then this is just kind of a wrap-up slide here, just pointing out everything we went over. Just that we have a strong inpatient for sure and outpatient experience. A lot of faculty for the 4 residents that we have, so you're always working one-on-one or even bouncing in between clinics at times, getting a lot of hands-on with procedures and lots of procedures like we talked about with the numbers we had, do a lot of neurotoxin spasticity back within pumps, fluoro, so we kind of do it all, whether you're at the VA or at the university. And oh, and also the last bullet point, there's free food when you're on site at Rusk. So that's always a good thing. Resident or medical students are always asking us about our food. So if you guys have any questions, I think that was our last slide. You can put them in the chat or ask on here and we can answer them. We also have our program director, Dr. Finkel's on here as well, if you have anything specific towards her.
Yeah, I can answer this one. So asking the biggest draw. So I'm actually from the area. I grew up in St. Louis, did med school in Kansas City. So location was a big one for me, but also besides that, this program is kind of feels like a family. There's 12 of us since it is an advanced program, but we're all pretty close. And all the residents that I knew above me were close to the attending as well. So it wasn't just like getting through the program, it was getting to know you as a person and then helping you out along your career as well. So that kind of drew me to the program. I'm sure Connor and Brian have a little different answers on that one.
Yeah, I mean, the big thing for me when I was looking at programs was I wanted a lot of procedures and I wanted an academic institution because I think I want to stay in academic. So, I mean, it was, kind of a no-brainer for me to, try to match here at Missouri, especially also doing my medical school in the Midwest in Indiana. So yeah,
Go ahead.
Mizzou does have a. Actually, you know what? I'll let Blake answer because Blake actually did his preliminary medicine here. So.
Yeah, so it is like Brian was saying, it is a prelim year, not a TY year. So it's a year of internal medicine. And like Brian was saying during the presentation, when you get an interview for Mizzou, you're automatically you meet with internal medicine essentially during the interview day, and you don't do like a separate interview for them. So I think the programs do a pretty good job of matching up together regarding your choices. So if you're interested in Mizzou, then you usually have a chance of doing a prelim here too. And then any score cutoff for step 2? No, we'll look at everybody fully. And then we're just kind of, there's no not like a set application score that we do or don't accept.
All right, well, there.
Any recent, not that I know of. Dr. Finkel may be able to answer that one a little more accurately.
Yeah, we have had IMGs. We don't have any currently in the program.
All right, thank you guys so much